and introduce our speaker, Dr. Praveen Golka sir.
Dr. Praveen Golka, ये एंटी मेडिसिन हेड डॉक्टर करंट एजुकेशन की सब अरविंदो मेडिकल कॉलेज एंड पोस्ट ग्रेजुएट इनका अनुसार बीजे मेडिकल कॉलेज अहमदाबाद बीपी कोयरान इंस्टीट्यूट ऑफ हेल्थ साइंस एसोसिएट प्रोफेसर इन BPIHS भारत नेपाल and professor currently he is professor at Sir Arvindo Institute of Medical Science Indore, Chennai Index Medical College Indore, Valorta Medical College Chiklam and RDRD Medical College Indore. Area of interest is med and identification, peer-reviewed journal, invited speaker in 49 annual Toronto Police Service Forensic Anti-Fiction Service Center. So sir, please start.
Institute, the institute which laid down foundation of my learning journey. My sincere thanks to Dr. Ajay Gaur for inviting me and giving me this platform. And for next 20 minutes, we are going to explore the learning domains and progression of learning. Although this is a basic topic for teaching learning, and most of the part you will feel that it was covered in first session, yesterday's first session during neuro education or linking of neuroscience with pedagogy. So you may find some overlapping because in most of the places in medical education you may find some overlapping like Bloom's taxonomy, like Miller's pyramid. So these are all overlapping things. So I shall be the objective of this session will be to cover these three domains: components of competency, then progression of learning, then Miller's pyramid, and then the competency. So I will just touch few all these subtopics. Now, three domains. You all know that teaching learning Bloom's from US in 1956. He gave the taxonomy to learning all these domains, three domains: cognitive domains, psychomotor domain, and affective domain. Then later on, Craikwall also contributed in giving the taxonomy, giving the sub domains to all these cognitive, affective, and psychomotor domains. Now, cognitive domain you might have, if you yesterday's topic, linking neuroscience with say pedagogy. That time you might have noticed that different areas of brain cover are responsible for different. We will discuss some domains of cognitive part. These are some domains discussed by Bloom's taxonomy: remembering, understanding, applying, analyzing, evaluating, and highest most is the creating. So this is hierarchical level give Bloom's taxonomy, and the student is able to define hypertension or is able to name 3 drugs used for hypertension. It is the lowermost level, just recall type or just kind of information which a student is having. Second part of cognitive level is understanding. Here he interprets the learned information. For example, if we give a set of say blood pressure readings, then he should be able to differentiate whether it is mild, moderate, or severe kind of hypertension. Applying is the third level of cognitive domain, that is use of concept in new situation. For example, patient is on propranolol and if he develops asthma, so he should be able to modify the treatment. So it is the use of concept in new situation that is applied. So Bloom's taxonomy is a form of pyramid. There are various hierarchical levels are there. Analyzing is distinguishing between facts and interference, considering the socio-economic conditions of the patient. Then evaluating, judging the value or worth of an action to predict the prognosis of the given treatment. And finally, creating part creating part puts together and drive meaning for the whole. For example, rational prescription for hypertension. So rational prescription for hypertension, this is the highermost level, hierarchical level of the cognitive domain. Psychomotor domain mainly response of motor response for sensory stimuli and this is skill developing domain. Again, it has 5 hierarchical level. Imitation is there, manipulation is there, precision is there, articulation is there, and naturalization is there. Imitation, observing, and we conduct a DOPA session, demonstration, observing, student observe, then practice. DOAP sessions are there, demonstration, observation, assistance, and performance. So DOAP sessions are there. So there are very different hierarchical level in psychomotor domain. Observing and copying someone else on dummy. For example, if we are demonstrating the student how to perform intubation. So that is lowermost level. He will be performing. We are just demonstrating the student about the intubation in a dummy. That is the lowermost level. Then manipulation. He will be doing this intubation following the instructions given by the. Then precision is accurate and he will be doing without original source. So he will be doing by his own on dummy. That is precision. Then articulation, 2 or more skills are combined and now he will be performing on a patient. So multiple domains he will be considering, he will be applying and then he will be articulating. Then naturalization, naturally he will be doing performing the intubation on a patient in a emergency, busy emergency room. So naturally he will be doing that, like we do swimming, naturally if we are a swimmer, cycling, driving a vehicle. So naturalization is the highest level of psychomotor domain. Then another domain is the affective domain. The affective domain deals with the feelings, emotions. Again, it has 5 hierarchical level. Lowermost is the receiving part, then responding, then organizing, then valuing, and then the internalizing part. Affective domain, receiving means, suppose a mother loses her child in, say, pediatric or neonatal ward. So, if a mother is crying in the ward, the lowermost receiving part of affective domain may be paying attention to what is happening around by the doctor. Then responding, participation and exploration, developing interest. So doctor may try to find out why she is crying. Then organizing, for example, clarity about the issues with no conflict, realizing that grief is inevitable on death of a child. Then valuing, saying soothing words, consoling her. So saying few soothing words to the mother is the valuing of her affective part, affective domain. Internalizing means developing a value system in the doctor. So it becomes a part of it and always develop the feeling or emotions toward the patient. So there are 5 hierarchical level of the affective domain. So all these 3 domains, cognitive domain, affective domain and psychomotor domain, they run parallel. Not step by not independently, but parallel. Then comes the competency part, components of competency. Now components of competency, we have already knowledge, skill and attitude. Those domains, knowledge is the cognitive, skill is the psychomotor and attitude is the affective part, mainly covered during ADCOM, which are suggested by the NMC. Now, progression of learning. Progression of learning starts from novice to beginner to competent to proficient. Novice is a rule follower. Whatever he will adhere to the rules which are taught to him. So that is a novice. It has no exercise of discriminatory judgment. beginner, limited situational perception, all aspects of work treated separately with equal importance. Then competent can do by himself. Whatever work is to be given, he can do by himself. That is a competent level of progression. Proficient have holistic view of the situation and can prioritize importance of all the aspects. So novice is unaware, incompetent, but by awareness he becomes beginner. So beginner has awareness, but he is still incompetent. But by training, beginner can become competent, and he is conscious and competent. And expert, then by practice, the competent can become an expert. And then later on he can do reflexly, unconsciously, and he is fully competent. So these are different phases of skill acquisition. Then progression of learning, novice to beginner. So novice says, please be with me. Beginner is the next step. Then competent can do it by himself. And then the last is the expert. Expert, then mastery, and then practical wisdom. Yes, I can make new way which can solve it better. So these are different ladders, phases of skill acquisition, novice to beginner to competent, to proficient, to expert, to mastery, and then have a practical wisdom. Then Miller's pyramid, it has been talked so much in all medical education workshops. I will not go in detail of Miller's pyramid. But only thing is that knows how, shows how, and then does. So these are different levels of Miller's pyramid, different levels of learning domain. First, the lowermost level is know. The student or the practitioner knows about the thing, knows how, shows how, and does. So these are different hierarchical level of competence. So all domains to be achieved in parallel and not step by step. So all this knows in attitude domain, skill domain, knowledge domain, all these domains are to be achieved in parallel, not step by step. So then only then journey can reach from novice to expert to proficient to higher level. For example, competency, a theme can be professionalism and ethics. So practitioner should show proper respect while examining a patient in OPD. So this is a practitioner should have professionalism and ethics. So practitioner should show proper respect to the patient in OPD. So there are different components of this domain. This theme, read the patient properly, will come the affective domain. Patiently hearing the problems of the patient, again the affective domain. Explain the clinical examination about what he is going to do, is psychomotor as well as affective. So one more domain has come into picture, that is communication. But the skill, sometimes it is covered under skill or separate domain is there. So, but basically three domains as suggested by Bloom's taxonomy, psychomotor, this cognitive, psychomotor and affective domain. But communication, some medical educationists, there are two different thoughts, those two different schools of medical education. One is coming from Dundee, UK thought school, from Harvard and those universities. So communication, they may give separate domain, but mainly cognitive, affective and psychomotor domains are there. So this was all about learning. But learning is a journey from knowing to doing to being. So they have to first know the things, then they have to start doing it, and then only they can become a compassionate doctor and healer. So in short, I have covered these three domains. Although it has already been covered at so many platforms, so I am not doing much emphasis on all these domains because this is basics of learning and might have been covered in previous sessions also. So that's all from my side.
Thank you, Doctor, for a very wonderful and interesting and inspiring talk. And yesterday's learning lesson for me started our topics now. So you explained it very beautifully to all the domains of learning and the real purpose of learning is it is beyond knowledge and this is what we have to practice and this knowledge brings us skills and proficiency. Expert, we become experts by that. Thank you, Doctor.
Thank you so much. And if we incorporate all the three domains together, then only we can be. So once again, I would like to thank Dr. Ajay and NCP 2000.
For this informative session. Now it's time for lunch break. We shall assemble back here in this room after half an hour.